Hello, friends. My name is Sadie Morway. I am a second-year doctorate in athletic training student at Indiana State University, and I'm really excited because today I'm going to be giving a presentation on understanding and managing pain. I'm in the healthcare field, and I also am involved with the fitness industry. I work with a kickboxing gym here locally, and with those two pieces, I see a lot of complaints of pain. And I don't think that a lot of people really understand pain and don't understand how to go about treating it and managing it. So that is what we are going to be talking about today. And I hope you walk away with a better understanding of what pain is, how it affects your body, and some steps that you can take to help navigate some of those barriers. Just a quick recap for those that are not familiar with athletic trainers. Athletic trainers are healthcare providers with specialty in sports medicine. So we're able to evaluate, diagnose, treat, rehab, and manage injuries and illnesses that are associated with movement. So basically anybody that's a moving human being, we probably can help you in some way or another. So that's kind of a little bit of the background. I've been practicing as an athletic trainer since 2011, so about 8 years of practice here, and in my second year of doctoral work through Indiana State. So here we go. We're going to get right into it. First and foremost, what is pain? I think that a lot of people experience pain, whether it's an ailment that is short-lived or it's something that's a little bit longer. And it's important to first understand what is going on when you're experiencing pain. So first and foremost, to take a big step back, pain is simply your body's way of letting you know that something's going on. Pain is really, it's triggered by something, and it's an alert system. So think of it that way. And how all of that happens, we'll get into a little bit more in this presentation, but the best way and easiest way to explain it is by its chemical reaction. So when something happens, so let's say you're injured or something is at risk, your body sends out warning signs. It asks for help. It recruits different things to come to the area and assist in what's going on, and it begins to protect itself. So pain, really, it's uncomfortable and it's not something fun that we really want to go through, but we have to view it as if it's kind of that warning sign. So when we're experiencing pain, instead of feeling negatively about it, I want to kind of reframe that thinking to go, if I'm experiencing pain, let's figure out what's causing it. And that way we can figure out how to make it feel a little bit better. So how your body talks to itself. So I mentioned that pain is initiated by chemical reactions. But I want you to think of it kind of like an electrical system. So think of it as if your body is wired with all these different circuits, okay? Imagine turning on the light, right? You go and you hit the switch and the light goes on. You don't see all the things that happen to make that light turn on, but there's an impulse from that switch that turns the light on. Think of the same thing when something happens at your skin. There are impulses that send that signal to your brain to tell you what's going on. So something from point A to point B to make that connection happen. So within the tissue, you have a bunch of different kinds of tissue in your body, and we could go into a lot of depth there, but just think of it as tissue. So whether we're talking about skin, we're talking about nerves, bones, muscles, ligaments, tendons, all of that, you have 3 different kinds of receptors. So think of it like 3 different kinds of hardwiring in your system. The first one is a mechanoreceptor. A mechanoreceptor is simply responsible for telling you about mechanical forces. So I want you to take 2 fingers and I want you to just press on your arm anywhere. Okay, so you obviously feel something, right? This is a mechanical sensation and your body is letting you know, I'm feeling pressure. Okay, now if you take 1 finger and you push a little harder, that sensation is different. Your body's able to differentiate those things. The same is true if you take a couple fingers and you gently move back and forth. That's a gentle pressure. Your body's able to differentiate those things because of the mechanoreceptors. So it's a mechanical electrical impulse that goes from your tissue to your brain to let you know what's going on. The next one is a thermoreceptor. So thermo, think of thermometer. This is gauging temperature. So obviously, if you put your hand on a hot stove, you're going to naturally, and how quick is that reaction time? That's how fast our impulses move. They move very, very, very quickly. So we're able to quickly remove our hand because we know that that's a danger for us. That is the responsibility of the thermoreceptors. And then the last one, and you actually have 3 different kinds of these, but we'll just categorize them in one family for now. These are nociceptors. So think of these guys as responsible for pain. So they're the ones that tell you when something is painful. And this can be a dull pain, it can be an achy pain, it can be tingly, it can be sharp. It's basically your body's way of saying, hey, something is painful for me. After those thermoreceptors say, move your hand away, it's hot, you might have gotten burned. And then you have nociceptors that say, I'm burned, something is going on here, I need a little bit more attention brought to this area. Hopefully that's making a little bit more sense about how your body is talking to itself. Now, what causes pain? So there's a wide variety of things that can cause pain. For the purposes of this, I'm going to focus on a few different things, some physical, some not physical, but in relation to the athletic population, especially, this is directed more towards the kickboxing gym that I work with. Injury is a huge cause of pain. So whether this is an acute, a new injury, or a past or chronic injury, you can have pain in association with injury. You can also have pain in association from an illness. So let's say you're fighting off an infection or you have some kind of underlying disease, whether this is a physical disease or a mental disease. Both of those things can cause pain. The same is true with trauma. This can be past trauma or recent trauma. We can have pain from both of those areas. And I think this is where it's really important to start honing in on the fact that pain is very, very complex. It might be a simple concept that it's our body's way of letting us know something is going on, but we're not always able to know why. Chronic pain is a huge issue here in the United States, and I think it's really crucial to start examining, why we're having some of these pains and try to tap into, is it a physical pain that's causing the issue? Is it a mental one? Is it emotional? So kind of keep that in mind. You can have a lot of pain from trauma that isn't physical. So it's really important to see that is a piece of the puzzle when we're talking to patients about how to manage their pain. And the last little piece I want to talk about causes of pain is pain tolerance versus pain threshold. So I want you to think of someone in your life that maybe has been through a lot, whether that's maybe they suffered a really big injury, maybe they've been through a lot in their personal life. And think about how that person was able to tolerate that pain. Humans can endure a lot. We're very resilient creatures in that way. So our pain tolerance, our ability to tolerate a lot of pain can be really, really great. Now, pain threshold, on the other hand, is how quickly we feel pain. So let's say I take this pen here and I press it into my hand. That doesn't hurt. But the more pressure I apply, finally I go, okay, that's my threshold. That's where I start to feel pain. If I do the same thing to someone else, their threshold for pain may be different. It may be higher, maybe lower. So hopefully you can kind of see that difference between the threshold of when I start to feel pain versus how much I'm actually able to tolerate. So somebody can have a really low pain threshold. Maybe the smallest little thing makes them go, ow. but they're able to tolerate a lot of ows before they're like, calling it, saying uncle. Okay, now I want to move into a few concepts that are a little bit more in depth. So stay with me here. So now you know what pain is. It's your body's way of letting you know something's going on. You know how it talks to itself with a bunch of different circuit systems. You know the difference between tolerance and threshold. You know what causes pain, that injury can cause pain, trauma can cause pain, disease and illness can cause pain. Now I want to start categorizing pain, because pain is not just one thing. Yes, we say pain is an uncomfortable sensation. It's our body's way of letting us know something's going on, but what does that mean? So why, if I have a headache, that's a very different kind of pain if somebody were to have rolled their ankle, or if somebody were to have experienced a car accident and now they have some maybe post-traumatic stress over the trauma from that accident. Do you see how all those different kinds of pain are very different? So I'm going to kind of break it down into 4 categories for you. The first one we're going to call inflammatory pain. So this is something that's caused by an irritant. So it can be an acute injury or a chronic injury. So let's say you are in boxing class and you're moving laterally side to side and you roll your ankle. You have some inflammation that might happen from that, and that is causing pain. The inflammatory process in and of itself causes pain. The reason it does that is, 1, it's, again, letting you know something is going on. It's telling your body, hey guys, I need some help here. That's its way of drawing in good nutrients and good chemicals to start that healing process. And also it's a way to guard. So inflammatory pain can be as a result of all those things. Then there's the category of mechanical pain. So this is something, think of mechanical pain like something's rubbing the wrong way. Let's say I sit at my desk all day with kind of rounded shoulders and I'm, typing away on my computer and my neck starts bothering me over time. It could be a postural issue. So maybe my biomechanics are not where they need to be, which is causing me pain over time. The same is true. Let's say I have kind of chronic shoulder pain with boxing. Maybe it's, again, because of that rounded shoulder positioning. Maybe it's all about how your body is working together and it's not working together the right way. So things are actually physically out of their normal alignment, if you will. And that is causing some inflammation and causing some pain. The third category is nervous pain. So nerve pain is a very different kind of pain than mechanical or inflammatory. If any of you have ever experienced your leg going to sleep, that's an example of nervous pain. There can be issues with your central nervous system. There can be issues with your spinal cord. There can be issues with your peripheral nerves. Carpal tunnel would be an example of a nervous kind of pain. So think of all those things. Those are the first 3 categories. The last category, and this one is the most complex, and it kind of is the alphabet soup of the last types of pain. As I said before, take the example of the person that was in the car accident. Let's say they were in a car accident and they had some physical detriments that were as a result of that, but they also have some mental associations that their body has naturally trained them on. So you got in this car accident, you had these bad things happen to you. Your pain level is going to be a little bit different because of what your body went through during that trauma. So that's an example of cognitive affective pain. The best way to describe it is really pain from the past that your body recalls. Typically, we see cognitive affective pain in patients with some other mental health concerns. So cognitive affective pain goes kind of hand in hand with depression, anxiety, PTSD. And I know these sound extreme, but remember, these are all a scale. Everybody falls on the scale somewhere or another. Everybody has some level of anxiety or some moments of of depression, if you will. So keep that in mind. And when we're considering these 4 categories of pain, it's going to be really important for you to reflect back on your own pain and almost put yourself in a pie chart. This is actually something that I do with patients when I meet with them and we're talking about whatever it is. My neck is hurting me. Okay, we go through a long history of what's going on, but a big part of my job is to make a pie chart for each patient. Everybody's pie chart of what their pain looks like is going to be a little bit different. So you can imagine a circle and there's 4 quadrants of what kind of pain. So inflammatory, mechanical, nervous, and cognitive affective. It's going to be really beneficial for you to be able to say, my neck's been bothering me for 8 years. I had a really traumatic experience, and now every time I re-aggravate my neck, it hurts even more. Is it really that it's hurting more mechanically? Is there really more inflammation going on? Or is a big part of that your body's remembering that you had that pain and it's kind of retracting back to that immediate, oh no, alert system, high alert, something terrible is going on. Keep that in mind, that it's all 4 pieces of the puzzle that work together. And it's important for you to recognize that so that you can help diagnose kind of what's going on in your own body. You know your system better than anybody. And if you're going to seek help from someone, the more information you know, the better it's going to be for your healthcare provider to be able to guide you on treatment measures. All right, so we know a lot about pain now, and that was kind of word vomit. And now what do we do? So, okay, Sadie, I have some pain. It's been going on a while. What the heck do I do about it? I'm going to go through 4 steps of pain management. And I want to first say, obviously, if anything is emergent, if anything is urgent, seek help right away. Even for those things that are more underlying or lingering and you don't think they're that big of a deal, keep in mind that the longer that pain sits there, the more at risk you are for chronic illness and chronic disease down the road. So never ever be afraid to seek advice and look for help. There are tons of resources online. There are tons of healthcare providers like me that are accessible to you, even just for guidance on what to do from this step forward. And another big piece of it is your own support system. So make sure that your family and friends know if you're struggling with something, because the best way of getting better is getting your network together and all collaborating to make something work a little bit more efficiently. So pain management 101, what do we do? Step 1, this is arguably one of the most important, probably the most important step. Figure out what your pain story is and write it down. So whether this was a physical trauma, a week ago, I hurt my knee doing this, write it down. Whether it was a traumatic event, something that you recall, or even if you're unsure of I don't really remember my neck is hurting and I'm not exactly sure how it started, but I know this, that, and the other. And start writing it down. Start brainstorming your own history to figure out what started the whole thing. The second piece of this, like I said before, is talk to others. Other people have a really good insight, especially significant others, family, friends, people that are around you. They have a pretty good insight, especially if they saw you going through some kind of pain. It's good to ask, hey, after I got in that car accident, what did you notice? Get their insight, because that can be really helpful, not only to have a good support system behind you, but also to get a different perspective. Sometimes when we're in a lot of pain, we tend to tunnel it in our own minds. It's important to kind of get out of that a little bit and get a different perspective. And the last piece, again, is seek help. If you're really struggling with something, there are resources out there, so don't be afraid to utilize them. But write down your pain story. Explain it to yourself so that you can actually understand it. Step 2 is monitoring. Again, if it's something that needs attention right now, that's a different ball game. But if it's something that you can spend some time monitoring. This is really important to know what makes it better and what makes it worse. Because when you go in for care, you need to be able to say, no, walking on it makes it feel better. It loosens it up. Or no, when I walk on it, it makes it so much worse. Those are important pieces of the puzzle when we're trying to help patients. So if you know the answer to that of what makes it better and worse, you really draw awareness to that, you're going to be a lot more successful in decreasing your pain in the big picture. So take time to pay attention to the positives and negatives. And again, write it down. Our memories are great sometimes. Step 3, this is the piece where we start to flip the script. So you know your pain story. You know what makes it better and worse. Now it's time to start examining which things that you can decrease that are aggravating it and increase that would make it feel better. So brainstorming ways to improve it. Maybe ice makes it feel better. Maybe medication makes it feel better. Maybe talking about it makes it feel better. Those are things we want to promote. Maybe doing too much activity at once makes it worse. Maybe certain shoes make it worse. These are all just examples I'm throwing out there, but this is your opportunity to set up your plan. So you know your story, you know what makes it better and worse. Now let's set up a plan. And the last and final step is action. So after you've set up a plan, now is our chance to find that relief. And this is my one recommendation here. Be patient and don't be afraid to slowly introduce relieving mechanisms. Sometimes when we throw a ton of things at something all at once, it's hard to know what was helpful and what was not helpful. So be patient and give it time for change. Again, seeking guidance in this step is going to be really, really, really important, especially for the layperson that doesn't necessarily know what measures, do I do heat or do I ice? Do I take medicine? Do I not? Do I rest? There are a ton of different options you have for treatment, and seeking guidance on which options you have so that you can choose the best one for you is going to be the best outcome that we could ask for. So kind of going back to those action changes, if you're noticing it's, if you've made your pie chart and you're saying, it's inflammatory and mechanical, I don't really think this is cognitive effective. My mental health and my social circle are wonderful. I don't really have a history of this. So I feel like I'm pretty set in this is a mechanical issue. It was a recent onset. I was punching the bag and I hit wrong and my wrist hurts now. I think I need to talk to somebody about how to treat my wrist pain. You're in a great spot. Do you see how we kind of follow that rabbit hole and now this is who I need to go see? Maybe you're on the other side and you're going, actually, I have a long history of knee issues and I tweaked it a little bit. I know it's not as bad as it was when I first injured it, but this is really, really painful for me for some reason. So now maybe we need to integrate the mental health component. Maybe we need to see a sports psychologist, or maybe we need to incorporate family and friends a little bit more in addition to your doctor visits or talking with an athletic trainer or physical therapist. So keep all these things in mind. The more information you know about your own story, the more beneficial it's going to be for your healthcare provider to be able to help you through it. And again, remember that this is a process. Relieving pain doesn't happen overnight. I know that we want to think that if we pop some pills, it's going to help to make us feel better, but pain is very, very complex. So give it some space to breathe and take it one step at a time. Starting with writing out that pain story and figuring out what type of pain you're actually experiencing can be the first step in really truly getting to the root of the issue and solving pain from the stem. The last piece, and this is just my little 2 cents, is take care. Take care of yourself. You deserve to take care of you. And if you're having pain, especially if you're falling into the chronic pain category, having pain anywhere from 3 to 6 months or more, you really should take those moments and take a deeper look at this. The risk of chronic pain and injury increases exponentially as the longer we wait on these things. So I encourage you to take care of yourself, and start by writing out your pain story. Thank you so much. I appreciate your time very, very much. If you have any questions at all, I am so happy to answer them. And I look forward to seeing all of you around the block.